And we're recording, okay? So, hello guys, good day. So, we are now in our week 3, which is module 3 in HIS, which is Primary Healthcare and Philippine Healthcare Delivery System. Class, so we will delve in today to primary healthcare, which is one of the most important element in the Philippine healthcare. It is an important part of the Philippine healthcare system. So let's get to know your primary healthcare today. So here we are going to define PHC. Grabe, ang rami kong definitions prepared for you guys. What are the elements and principles of primary healthcare? Discuss the involvement of primary healthcare in healthcare management, describe the status of your primary healthcare in the context of the Philippine healthcare system. Yan. So, class, so ito yung sa pinakamaikling definition for today. So, what is primary healthcare? So, class, unang linya pa lang, a whole society approach to health and well-being centered on the needs and preferences of individuals, families, and communities. So class, whole society approach. So if you want to tackle the problems of health, yan, we need that the whole society, not only the health sector is involved. Here includes our president, here includes engineering, DPWH, the LGUs class whole of society approach. Yan. The private companies, the public sector, yan, for health and well-being yan, centered on the needs and preferences of families and community yan. So may na-sketch na tayong konti. What else, class? First one, it addresses the broader determinants of health. So class, there's so much factor affects your health, class. So where you work, where you sleep, where you eat, are affecting your health. What else? That determines your lifestyle, your environment, class, the class traffic, your online class, that can determine your health, diba? Either it will give you um, so yung stresses ng online class, diba? Either ang ending nito, good health or bad health, diba? Good mental health or mental health breakdown, diba? Ang raming factors na nag-affect sa health natin. What else? It focuses on comprehensive and interrelated aspects of physical, mental, social health, and well-being. Focuses on comprehensive. So it's very broad. Yan. It's very broad. Different health services that focuses your physical, mental, and social health and well-being. What else? Last, I think itong maganda to, itong binold ko dito, ito. Yan. Communities first and main point of contact with the health system. So how is this related with our module 2? It's the first and main point of contact. So example of primary healthcare is the one that is nearest to you. Yan. Perhaps your parents can be primary healthcare. Perhaps your health centers or barangay health station. So if we are all in the University of Baguio, our primary healthcare would be the University of Baguio Clinic. And so it's the first and main point of contact. Yan. Providing the right care at right time, right in their communities. Kaya ang ganda-ganda ng goals, ng adhikain ng primary healthcare. Actually, it's so idealistic. Yeah, that's why I love it. Yan. So what else? Yes, marami, no? But we're just exploring it. So what else? It addressed the health needs through continuum of care or integrated system of care. It addresses the health needs through continuum of care. So when we say continuum of care or integrated system of care, the health services last throughout the whole lifetime of the person. So we take care of you when you were a baby. We will take care of of you. Now you are a young adult. We will take care of you if you will be a mother or you will have a family. We will take care of you once you are a senior citizen already. Yan. And if you have chronic disease, we will give you palliative care. So it addresses the whole needs of the whole life continuum of the person sa buong lifespan in every levels of your age class. Ganon katindi ang primary healthcare. May health services sa kahit anong edad. Yan. What else? Provides health services which are for health promotion, prevention, up to the management of chronic health conditions. So we have from the vaccines when you are a baby or for promoting health up to your maintenance, up to your dialysis, up to the management of chronic health conditions, up to chemotherapy. Dapat ganon katindi ang primary health care. Yan. The first point of contact. What else? Delivering the essential health services like vaccination, reproductive health, maternal, newborn, and child health care. Yan. So class, mapapansin niyo lang, men, that meron tayong maternal, newborn, and child healthcare. Walang ano dito, parang paternal healthcare yan. Because many women are still at risk every time that they are going to deliver a baby. Yan. So we need to take care of them. Yan. So equity yun. Yan. What else? So primary healthcare, then and now. So this is just a short timeline. Where did primary healthcare come from? Yan. First was in 1978, the Declaration of Alma Ata. Yan. Don't ever forget that. So Alma Ata is a place actually in Kazakhstan. So Alma Ata Alma Ata. Yan. Alma Ata yung pangalan niya noong 1978. Now, the name of the place is Almaty, Kazakhstan. So, back then, in 1978, Alma Ata was part of the USSR. So, part pa siya ng Russia noon. So, now, it's in Kazakhstan. So, back then, all the international leaders made an agreement, made an international declaration that health is a human right. Noong 1978 class, nag-decide ang bawat leader ng big countries, developed or non-developing countries, that health is a human right. And they established that having primary healthcare is utmost important. Yan. So in 1979, it's monumental for primary healthcare. Back then, so they established, and every global leaders around the world, class, they decided that health is a human right. Health is a human right. 1978, si Cory ba ang presidente dito? Yan, I think. Next, Millennium Development Goals. So, after that primary healthcare. So, marami na rin namang mga declaration and such, but we'll just talk about the peaks, the highlights. So now, in the basis of primary healthcare, nagkaroon tayo ng Millennium Development Goals. So these are big goals that the different world leaders again established that nag-meeting sila ng 2000, and by 2015, they're trying to achieve 8 goals. Later, I'll show you what's the 8 goals. So, noong 2015 class, many goals were not achieved, pero marami namang progress since that. And I like Millennium Development Goals. And now, class, we are in the Sustainable Development Goals era. For the next, from 2020, so after 10 years, it started in 2015. So, the end time of sustainable development, gagawa na naman tayo ng ibang goals pag hindi na naman natin nakamit or may kulang pa. So, in 2030, class, 17 goals naman yung gusto nating ma-achieve in the Sustainable Development Goals. And in the Philippine context, we have RA 11223, Universal Healthcare of 2019. So, class, still universal healthcare, its goal is it wants that healthcare will be universal, it will be for all, and strengthening the primary healthcare is one of that, class. So mahalaga ang universal healthcare. You know, So far, I'm always mentioning universal healthcare, but as of now, I'm researching, it's not yet implemented. Hindi pa rin. Ang taas ng ano natin dyan ang taas ng, we're rooting for universal healthcare in the Philippines, but so far, it's not yet implemented. Ayan. So class, in your Millennium Development Goals, so here are your, yan, tinuro ko, hindi, yan, so ba, yan. So, we have 8 goals here. Ito yung 2000 to 2015. Grabe yung mga, the biggest feat, FEAT, the biggest feat, the humanity wants to achieve. Yan. Kaya sabi niya, eradicate extreme poverty. Yan. Wow. Achieve universal primary education. So, mawala daw yung poverty, hunger, wala daw magugutom. So, achieve universal primary education class kasi maraming hindi nag-elementary and such. Promote gender equality, empower women, reduce child mortality. Many children are dying. Improve maternal health. Yan, many rin. Pregnant women are dying. Combat HIV/AIDS, malaria. Ensure environmental sustainability and global partnership. Yan. So, yan yung Millennium Development Goals. Ang ganda-ganda, no? Class, I want you to be familiar kasi you're going to be health professionals. And class, we have now this one. So, from 8, mas naging, mas naging hopeful pa, or sabihin natin, maraming comments, class, sa SDGs and MDGs na achieve ba natin yan? Ganyan. Marami rin syempreng naysayers, di ba? So, class, sustainable development goals. So, perhaps you are always encountering the word sustainable or sustainability. Sabi niya, it focuses on meeting the needs of the present without compromising the ability of future generation to meet their needs. So, class, it's very applicable in this generation na, 'di ba, we want more people that are younger than us, that they will enjoy what we are enjoying right now. So that could be possible through this sustainable development goal. So number 1, pinaghiwalay na nila yung sa MDG, no poverty. How, 'di ba? Ganda sigurong mundo yon, class. There's no poverty. Number 2, zero hunger. 3, good health and well-being. Wow, sobrang isa na lang yung health. Talagang yan. Quality education 4. So not only primary na ngayon, pati college siguro. Number 5, gender equality. 6, clean water and sanitation. Class, that's true. Many people still do not have clean water, and many people still do not have a toilet at home. Yan. Affordable and clean energy. And if you want the future generations that they will meet their needs, diba? We need to be mindful with our energy usage, decent work and economic growth, not only for the few but for all. Industry, innovation. Class, basahin nyo na lang. Pero kasi, ang ganda-ganda. Sa huli, mga climate action, life on land, taking care of our plants and animals in water, on land, peace, justice, and strong institution partnership for the goals. Grabe, ganda, guys. So, di ba, hopefully, I want you to be part of this, diba? That we will be able to achieve this such goals. Grabe. Binrake daw naman to, class. May kanya-kanya indicators to. So, yan. Marami namang improvement dahil dito sa mga goals na to. At marami nga rin kumukontra. Yan. So, according to Alma Ata, ganito niya define, class. Ang haba, pero kasi ang ganda. Primary healthcare is essential healthcare. Yan. Di ba nung Alma Ata, sabi niya, health is a human right. Health is a human right. So meaning, guys, that if someone is unhealthy or someone dies because of preventable causes, class, pwede namang hindi siya namatay sana because that disease is very preventable. Class, that is injustice. If you cannot, sabi nga health is a human right. So if you cannot access your health needs at the right time, that is actually injustice. Yan, kawalan ng hustisya. Wow. So primary healthcare is essential healthcare. So it's basic, based on practical, scientifically sound, and socially acceptable methods and technology, which are accessible to individuals, families, and community through their full participation at a cost that the community and country can afford. To maintain every stage of their development, so continuum of care, in the spirit of self-reliance and self-determination. So class, they define primary healthcare as something essential and something that empowers the communities and the families, that they want the families to be able, the communities to be able to provide primary health care to each barangay or to each villages. That it is something that is not very expensive to maintain. Ganon. That is something sustainable. So, class, ang primary health care, yun nga, empowers the people na lahat, para ma-achieve natin yung primary healthcare, lahat kasali. Yan, lahat kasali, mayaman, mahirap, yan. So, sino ba itong mga to? Mga barangay health workers, the different groups in the community, yung mga youth organization, senior citizen, farmers organization, sama-sama, yan. Sabi niya full participation of the community Yan. Na pag nag-ambag-ambag ang mga community, ma-achieve nila itong primary healthcare. They will provide health at every stage of development. Grabe. Ganda talaga, class, ng primary healthcare. And I love it. Yeah. So what are the elements of achieving the goals of primary healthcare? Yeah. So we will just break it down for you. Yeah. So first is, how would we achieve? Sabi niya, reducing, sabi sa inyo, hindi lang health ang involved po. Reducing exclusion and social disparities in health. Reducing exclusion and social disparities. So, we need to remove barriers, mga barriers that prevents the underprivileged in accessing healthcare. Yan. So, uso ba ang racism dito, guys, or regionalism, ganyan. So, yun. Tanggalin natin yung mga ganong beliefs. What else? Organizing health services around the people's needs and expectations. Service delivery reforms. Yan. So, changes in how we deliver healthcare by organizing it, making it simple for everyone. Pursuing collaborative models. Yan. So, partnership from the government to the different civic groups, increasing stakeholder participation. So mag-invite tayo, example, yung smart communications like Globe, ganyan. How could you participate? Yan. Stakeholder participation How do you participate in our, kunyari, dissemination of coronavirus information, di ba? Nag-message sila, something like that. Or nagpo-post sila about hand washing, ganyan. Or wearing masks, di ba? Yung mga ganun. Increase stakeholder participation. Now, class, in the coronavirus, di ba, kasama ang AFP, ang mga Navy. What else? Integrating health into all sectors. Yan. So, if they're trying to make different laws with regard to DNR, to agriculture, with regards to the different departments in our government, they want that health will be in mind. And how will these laws affect health? Example, one of the issues right now is about the Manila Bay, and they're trying to make it as a white sand beach. And one of their solution, guys, is to add dolomite lime in the beaches to make it white. And DOH was commenting, and actually I tried to Google it. Does dolomite have any health impacts? Yeah, because that's what DOH is saying. And actually, according to material safety data sheet, there are side effects of your Dolomite. Yeah. So, interesting lang rin that those kind of reforms, so health was not in mind in that case. Yan. 4 principles of primary health care. So, class, yan. How would we achieve? What are the principles? How would we get there? So, through community participation, by empowering the community that you can do this, community. Yan. But unfortunately, class, many barangays here in the Philippines do not have hospitals or health care that are close to them. Yan. I am watching documentaries by Sarah David. Ano yung title ng ano niya? Documentaries by Sarah David that they have to walk, some people have to walk 4 hours to get to the nearest health center. And apparently once they get there, after walking for the last 4 hours, they found out that the doctor was in seminar or in conference. That's how difficult it is, guys. So, and class, they do not have any ambulance. Their ambulance was a tawag doon, just a bed wherein 2 men are carrying that bed, that makeshift bed, parang ganyan. Tapos bubuhatin ng 2 lalaki and they will walk for 4 hours. However, class, they are helping each other in the community. So if someone is sick, there will always be 2 people who are ready to carry either patient, yan, and walk for the next 4 hours. Ganun, class. Ganun katindi ang healthcare dito. What else, class? There are still beliefs in the community that instead of thinking that someone has a disease, that they are cursed, ganun. Example, the cases of elephantiasis, wherein when you have elephantiasis class, or filariasis, you are bitten by a mosquito. Galing yun sa mosquito which carries a parasite. Tapos class, its effect is it will cause the enlargement of your lower extremities. Yan, pag elephantiasis. So in men, there is enlargement of the testicles. In women, there can be enlargement of breasts, of legs, something like that. Yan. And some community beliefs thinks that they were cursed or something. So they're trying to burn this person. Plus, I watched it in a documentary. Ganun katindi. So if everyone in the community participates for the well-being of each other, then it can contribute to the well-being of the community. What else? Intersectoral participation. So DNR should be involved. Other different groups, Bill Gates, whatever, guys. Okay. Equity and social justice in mind, that you want to help the disadvantaged and give them more opportunities. What else? Affordable, appropriate technology. Yeah. So the technology should not be not expensive for the community. So what is the context of your primary healthcare in the Philippine healthcare system? This is just a review, class. So first one, sabi niya, DOH has split the authority over the delivery of health services among LGUs. Yan. So class, so if you remember our topic, so the local government code, wherein the DOH power has been divided. So they are not the complete authority when it comes to healthcare. They split, or they they divided the authority to the LGUs. Yan. So there is decentralization of power. So the power is not centralized, or not only from DOH but towards the LGUs. And class, I'm searching for the impacts of that. Actually, it's very hard to measure if the centralization is effective or not. Yan. But yeah, that's what's happening. The LGUs are responsible for the health services. So class, we have 81 provinces in all in the Philippines. So there are 81 LGUs, and this LGUs class, under it, there are 1,490 municipalities, and within those 81 provinces, there are 145 cities. Yeah. So class, they are in charge with delivering healthcare. What else? Class, health force are experiencing underemployment. Yeah. There are limited resources, PPE for them, and they are unequally distributed. So meaning, class, our health workers wants to work in Manila. If not in Manila, yan, they want to go abroad. Yan. Or in the cities. Yan. So the impact of that are there are not enough health workers in the rural areas. What else? Increase privatization of healthcare system. Yan. So many are so when there is increased privatization, meaning there are many for-profit hospitals or health facilities. Yan. So that's very risky if you don't have a choice but go to a private hospital, because that can be very expensive to our normal Filipino class. You know? Increase out-of-pocket spending of Filipinos. Yan. Class, you know, PhilHealth. PhilHealth, you have to pay 300 pesos a month for PhilHealth. Yan. But you know, class, unfortunately, many Filipinos do not have 300 pesos a month to pay for PhilHealth. So PhilHealth can also be a burden for Filipinos. Yan. Increase out-of-pocket spending. But so far, PhilHealth, through universal healthcare, class, indigenous people, senior citizen now have free healthcare. Yan. Pero how about the rest of Filipinos, right? So 8 essential elements of primary healthcare. So education for health, class. So we want to teach people about healthcare. You know, there's a study that the higher level of educational attainment of mothers, the healthier the children. So you want to educate, especially mothers, yan, so that they will take care of their baby well. Yan. So next, locally endemic disease prevention and control. Yan. In different areas, class, example, yung what I mentioned a while ago, in I think region 8 yan, I'm not sure. So in communities class, wherein abaca is a main livelihood, yan, acquiring abaca, because abaca is an important material for making money, class. But however, these abaca trees are where your mosquitoes with parasites live. Yan. So these abaca workers are bitten by these mosquitoes, and apparently the parasite causes elephantiasis and filariasis. So if they would be educated on how to prevent these diseases, example through mass mass parasitic drug um, mass parasitic drug intervention by giving them anti-parasitic drugs, and you can control it. It's very controllable. It's very preventable, class. You know, if you have filariasis, yan, it's very difficult to walk. Yan, elephantiasis. It's very difficult to walk. Yan, how could you work in the farm if your feet are enlarged? You have difficulty walking, di ba? In places, class, wherein malaria is endemic. Yan. I think in Kalinga, there's still malaria. In Sultan Kudarat, there's still malaria. So yan, let's control it. Here in Baguio, there's amoebiasis and dengue. It's very common here in Baguio because of the way the water system here. Yan, water here can be contaminated with the sewage system. Kasi nga, class, some people live beside the hills. Yan. So the sewage system and the water system are overlapping. Yan. What else? Expanded program for immunization. So these are the ways that we could achieve primary health care. Maternal and child, including responsible parenthood. So taking care of maternal health and child health, and also planned parenthood or family planning. Providing essential drugs like vitamins, antibiotics, maintenance for your chronic diseases, nutrition, class. treatment of communicable and non-communicable disease. Class, just a review. So communicable disease are diseases which are contagious. Diseases which are contagious. Non-communicable disease are diseases which are not contagious. Diseases which are not contagious. So COVID, class, ano, communicable, non-communicable. Yan. Cancer, communicable, non-communicable. Yan. Isipan nyo yan. And safe water and sanitation. Class, if you don't have safe water, you are prone to waterborne diseases. Yan. So, giardiasis, yan, which is caused by Giardia lamblia. Salmonella typhi, class, waterborne disease yan. Salmonella typhi, which causes typhoid fever. Amoebiasis, class. So, yeah. Waterborne diseases. So, unsafe water can result to waterborne diseases. What is the spelling of waterborne? W-A-T-E-R, borne, B-O-R-N-E. Okay, waterborne disease. So class, actually we're almost done. Unti na lang. So levels of healthcare facility. So in your notes, there is levels of healthcare, referral, and levels of healthcare facility. I think they overlap each other. So class, let's look at here at the bottom portion. So we have primary, so BHS, we have barangay health stations, private practitioners, puriculture, center, community, hospitals. Puriculture is childcare. Yan, mga focus on childcare. Health centers, rural health units. So these are your primary healthcare facilities. Yan. So this is your first point of contact. Yan. So those which are closest to you, clinics of companies and universities, primary healthcare yan. Class. Next, we have secondary. We have your district hospitals. Yan. So class, my province is in Nagilian and we have a Nagilian district hospital. Class, it's so small. However, it will do. Yan. Because class, the more severe case, we need to bring it to San Fernando. And Nagilian to San Fernando is about 45 minutes away, something like that. So, di ba, mahirap rin pag may emergency. At least, second, the Nagilian District Hospital has stabilized the patient before bringing it to San Fernando City, La Union. Yan. What else, class? Tertiary. Yan. Tertiary hospitals are these big hospitals like BGH, Baguio General Hospital, class RITM, yan. Research Institute for Tropical Medicine, NKTI, National Kidney Transplant Institute, these big hospitals. East Avenue Medical Center, San Lazaro Hospital, these are national health services and regional health services. So class, let me just give you an example of tertiary hospitals. So in my example, in HIV testing, confirmatory test of HIV test class is Western blot test. And this Western blot, to achieve it, you need specialized machines. And class, not all the laboratory here in Baguio has the capacity to perform Western blot, the confirmatory for HIV. So what do we do? So usually class, all the people who will test for HIV here in Baguio are only screening tests. Yan, screening tests only. So the screening test looks like a pregnancy test. And class, if the person is positive for HIV in the screening test, yan, they are we call it presumptively positive. The medical technologist, the laboratory, will bring the specimen in San Lazaro Hospital because they have the capacity to test for HIV. So, San Lazaro Hospital is our reference laboratory for HIV testing. Yan. Example, class, for testing for drugs, confirmatory test for drugs. Here in the provinces, in the cities, class, so we only do screening tests. And if you want to confirm the person if they are positive, really positive for that drug, we bring the specimen in East Avenue Medical Center. Yan, East Avenue Medical Center. Yan, so sa HIV class, it's San Lazaro. So for drug, it's in East Avenue Medical Center. Yan, something like that. So, tertiary facilities are very important. Yan. So class, what else? Levels of primary healthcare workers. Yan. So let's explore. Yan. Who are the primary healthcare workers? So the most basic primary health workers are your grassroots or barangay health workers or village health workers. Class, ang amazing. Grassroots meaning are the groups in the barangay. Yan. So class, we need this. Usually this barangay health workers, village health workers, grassroots, sometimes they only work for incentives. They work voluntarily. Ganun. So they are trained community health workers. Yan. So they volunteer in assisting health. Yan, grassroots, barangay health worker, and village health workers. Next class. So we have intermediate level health workers. Yan. So they are a bit higher than your barangay health workers and village workers. They are actually your doctors already, public health nurse. So they supervise your grassroots and barangay health workers. Yan. So they attend to health problems which requires more training. Yan, intermediate level health workers. And we have first line hospital personnel. So people, health workers from the hospitals can assist the intermediate level health workers. Yeah, because I just have this story that I met with an NGO class. I met an NGO here in Baguio, and their goal, what they do, this NGO class, is they train grassroots people. Yan, they train grassroots people in Cordillera because still many places in Cordillera do not have health centers. Class, wala silang health centers. So what they do is this: they train these grassroots for attending birth. Yan, binabantayan nila yung delivery. They're training them to do minor surgeries. Class, they're training them to be prescribing drugs. Yan. They're training grassroots people. Yan. And class, in the Cordilleras, usually their work are farming. Yan. And class, the busiest time of farmers especially is during the summer. And they go there during the summer. But what they do, so all people are out in their gardens or in their farm. Yan. So how would they solve the problem if all the people are busy and they don't have anyone to train? The rest of the community will say to the person they want to be trained. So they have a leader and they will say to that leader, please, magpa-train ka na. So, magpa-train ka na as a community health worker because when we will need health services, we will approach you. We will farm for you. Yan, we will farm for you. So, yan, they volunteer to be the rest of the community who will not be training volunteers that they will be the one to cultivate the land for them. Yan, because they would know that they will benefit on the training of the person that they chose to be trained. Ganon. Grabe, no? We work with what we have here in the Philippines. Yan. So amazing. Yan. Class, gusto ko yung mag-work sa NGO one day. Yan. Why not? So class, this is an image from your module. And this is a hierarchy on data flow. So in relation in our health information system class, so this is how reporting happens. Diba? So your community health services will make a report. They will give it to the health facilities and village government, and this village government class will give their reporting to district councils up to the DOH. Ganyan. So, ganun. Galing rin, no, class? But imagine the different levels who has to make a report. Yan. And so we have to maintain data quality. And I hope that there's no duplication of work. something like that. So feedback can be received for a very long time kasi nga matagal rin gumawa ng report. How would you expect to have a feedback immediately coming from 81 provinces? So mahirap rin, class, for DOH to do that. And lastly, class, so these are different management concepts. So not only in primary healthcare, but in different industries, class. But let's focus on primary healthcare. So as a healthcare manager, so these are the things that they have to be doing. So planning, organizing, staffing, controlling, and directing. Yan. So when we say planning, so parang DOH, they set the priorities and the direction, determine the performance target. So what to do, what are the objectives, yan. So that's in planning. What's their end desire? They set the vision and the mission. Organizing, yan, designing the patterns of reporting and communication. So organize. So who will be the boss in this place? Who will be the manager? Yan. Determining the positions and teamwork. Who will be grouped together? Yan. What is your team? Yan. Distribution of authority and responsibility. So those are all organizing. Staffing, so about the human resources. So give them schedules, train them, acquire them, retain them, give them bonuses. Controlling actually the people. So we evaluate their performance. Yan. If there is something wrong that they did, give them a memo or give them corrective actions. So correct them, reward them. That's controlling. Directing, initiating actions in the organization, leadership, motivation, and communication of managers. So class, so I want to thank you for listening once again. So I'll see you in our next module.